Cefazolin Sodium Vial is a type of antibiotic that is used to treat many different types of bacterial infections. It can also be used before and during surgeries to help prevent infections. This medication falls under the category of cephalosporin antibiotics, and it works by stopping the growth of bacteria. It is important to follow the dosage instructions provided by your doctor and to take this medication at the same time each day for the best results. If you have any concerns about taking Cefazolin Sodium Vial, be sure to talk to your healthcare provider. When using Cefazolin Sodium Vial, the medication can be given through an injection into a vein or muscle, depending on the specific product. It's important to follow the instructions given by your doctor and use the product exactly as directed. The dosage of this medication is determined based on your medical condition and how you respond to the treatment. For children, the dosage is also based on their weight. If you are administering this medication to yourself at home, make sure to learn all the preparation and usage instructions from your healthcare professional. Before using, visually inspect the product for any particles or discoloration. If you notice either of these, do not use the liquid. It's important to also learn how to store and discard medical supplies safely. For the best results, it's recommended to use this antibiotic at evenly spaced times. This will help you remember to use it consistently. It's also important to use the medication at the same times every day. Continue using this medication until the full prescribed treatment period is finished, even if your symptoms disappear after a few days. Stopping the medication too early may cause the infection to return. If your condition persists or worsens, make sure to inform your doctor about it. Side effects of Cefazolin Sodium Vial may include swelling, redness, pain, or soreness at the injection site, as well as loss of appetite, nausea, vomiting, diarrhea, or headache. If any of these effects persist or worsen, notify your doctor or pharmacist immediately. This medication has been prescribed because its benefits outweigh the risk of side effects for you. Many people using this medication do not experience serious side effects. However, if you experience dark urine, easy bruising/bleeding, fast/pounding/irregular heartbeat, seizures, unusual weakness, yellowing eyes/skin, or mental/mood changes, contact your doctor immediately. Cefazolin Sodium Vial may rarely cause a severe intestinal condition due to a bacteria called C. difficile. If you develop persistent diarrhea, abdominal/stomach pain, or blood/mucus in your stool, contact your doctor right away. Avoid using anti-diarrhea or opioid products, as they may make symptoms worse. Prolonged or repeated use of this medication may result in oral thrush or a new vaginal yeast infection. Contact your doctor if you notice white patches in your mouth, a change in vaginal discharge, or other new symptoms. A serious allergic reaction to this drug is rare, but seek medical help immediately if you experience symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed here, contact your doctor or pharmacist. It's important to inform your doctor or pharmacist if you have any allergies to cefazolin, other cephalosporins, penicillins, or any other allergies. This medication may contain inactive ingredients that can cause allergic reactions, so it's important to talk to your pharmacist for more details. Before using cefazolin, make sure to inform your doctor or pharmacist about your medical history, especially if you have kidney disease, liver disease, or stomach/intestinal diseases such as colitis. Cefazolin may also affect the effectiveness of live bacterial vaccines, so it's important to inform your healthcare professional before receiving any immunizations or vaccinations. Before undergoing surgery, it's important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or breastfeeding, make sure to consult with your doctor before using cefazolin. Drug interactions can affect how your medications work and increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription/non-prescription drugs and herbal products. Don't make any changes to your medications without your doctor's approval. It's also important to note that this medication may interfere with certain lab tests, potentially causing false results. It's essential to inform lab personnel and all your doctors that you are taking this medication. If someone has taken too much cefazolin sodium vial and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canada residents can call a provincial poison control center. Symptoms of an overdose may include difficulty breathing and seizures. Remember, do not share this medication with others. Cefazolin sodium vial has been prescribed specifically for your current condition, so do not use it later for a different infection unless your doctor instructs you to do so. Keep in mind that your doctor may order lab or medical tests, such as a complete blood count or kidney function tests, while you are using this product. It's important to attend all scheduled medical and lab appointments. Be sure to consult with your doctor for more details. As for the benefits, daily dosage, and optimal timing for taking this medication, it's best to follow your doctor's instructions closely. They will provide you with the most accurate information tailored to your specific condition. Make sure to take each dose of cefazolin sodium vial as prescribed by your doctor. If you happen to miss a dose, be sure to consult your doctor or pharmacist for a new dosing schedule. Do not take a double dose to make up for the missed one. Be sure to follow the instructions on how to store the product and keep it out of reach of children and pets. Do not dispose of the medication in the toilet or drain unless directed to do so. When the product is expired or no longer necessary, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.